Musculoskeletal, Part 2. Long bones in children have three main parts: the central diaphysis, the original site of ossification during the fetal development, a metaphysis, and an epiphysis at each end. Chondrocytes synthesize cartilage in the growth plate region, which continues growth followed by ossification. Until puberty, the growth plates experience active bone formation through continuous cartilage synthesis followed by calcification, erosion, and osteoblast invasion. Bone healing in children is similar to the same process as in adults. A rich nutrient supply to the child's thick, strong periosteum causes the bone to heal more quickly. Children's bones have an increased capacity for remodeling, which is the process of breaking down and forming new bone. Common fractures in children include A, a buckle, B, a green stick, C, a complete, and D, physeal fracture. Developmental dysplasia of the hip is relatively common. It's a musculoskeletal disorder in infants. In developmental dysplasia, the femoral head has an abnormal relationship to the acetabulum, leading to hip joint instability. This is considered a developmental disorder because of the various range of presentations. Children's fractures, the growth plate is the most concerning because it causes damage to the physis and part of the metaphysis. Musculodystrophy is an umbrella term for 9 inherited conditions that cause progressive skeletal muscle weakness and wasting. Some types are more severe, but all types demonstrate advancing muscle weakness over the lifetime. The muscular dystrophies are most often diagnosed in childhood. Duchenne's muscular dystrophy and Becker muscular dystrophy have an X-linked inherited pattern. The bone disorder osteogenesis imperfecta results in low bone mass, increased bone fragility, frequent fractures, and connective tissue problems such as joint hypermobility and instability. A defect in genes associated with collagen type 1 is most often inherited through an autosomal dominant pattern with variable expressivity. Age-related changes to the musculoskeletal system include loss of muscle mass and strength, known as sarcopenia, decreased bone density, and degenerative joint disorders. Chronic inflammation contributes to osteoporosis, muscle aging, and joint disorders. Fracture risk increases with age, with frailty and neuromuscular instability as contributing factors. Hip fracture is associated with increased mortality risk within the following year. Adults experience a progressive decrease in muscle mass proportional to body weight as they age. Sarcopenia refers to the loss of muscle mass and strength. Between the ages of 50 to 80, muscle mass and number of muscle fibers can decline by as much as 50%. Bone density also decreases with age, declining on an average of 0.5% per year in healthy older adults. Osteoporosis is the most common in postmenopausal women and throughout aging trajectory. Osteoporosis is more common in women than in men. Various risk factors for osteoporosis include smoking, alcohol use, vitamin D or calcium deficiency, low physical activity and strength, low body weight, history of previous fractures, parental history of hip fracture, treatment with glucocorticoid medications, presence of rheumatoid arthritis, and Caucasian ancestry. Osteoarthritis is a degenerative joint disorder where there is progressive loss of articular cartilage accompanied by remodeling and hypertrophy of the adjacent bone. Osteoarthritis is the most common form of arthritis and causes significant disability, especially in older adults. It commonly affects the knees, spine, and various joints of the hand. Swelling and bone deposits, or osteophytes, are observed when inspecting. Gout is a common arthritic disease where monosodium urate crystals are deposited in joints, bones, and soft tissue, resulting in acute arthritis and chronic tophi gout. Uric acid is the end product of purine metabolism and is a normal constituent of extracellular fluid. Uric acid crystal formation is promoted at high levels of uric acid, hyperuricemia.